More often than not, patients with type 2 diabetes look towards natural medicine in addition to their conventional medicine for help in treating their disease. Natural medicines and using food as medicine is a wonderful way to complement your diabetes treatment. However, if added without the correct knowledge or guidance, mixing herbs, supplements and medicines can lead to a drop in blood sugar called hypoglycemia. Here are 10 natural remedies and treatment for type 2 diabetes. 1. Apple cider vinegar. The primary compound in ACV is acetic acid and is believed to be responsible for many of its health benefits. There are many evidence-based approaches to using ACV. Taking 2 tablespoons before bedtime can reduce your morning fasting sugar levels. Even better, 1 to 2 tablespoons of ACV taken with meals can decrease the glycemic load of a carbohydrate-rich meal. I generally tell patients to either consume ACV alone, prior to a meal, or mix it into salad dressings or teas. 2. Fiber and barley. Eating fiber decreases blood sugar and insulin concentrations. The recommended amount of fiber is around 30 grams per day. Most Americans get around 6 to 8 grams, which is not nearly enough. While you can take fiber supplements like Metamucil, psyllium husk, the best way to reach your goal is to eat your veggies. Barley is a high-fiber, high-protein grain which has lots of data to support its role in helping improve blood sugar, insulin, cholesterol and general inflammation. Barley does not require soaking and usually can cook in less than 15 minutes on the stovetop with just some water and salt. 3. Chromium. Mainly found in brewer's yeast, deficiency in chromium impairs the metabolism of glucose. Evidence supports chromium for lower blood sugar and A1C levels. Be careful if you have kidney disease with this supplement. 4. Zinc. Those with diabetes are commonly found to be zinc deficient. Studies have shown zinc supplementation can reduce blood sugar and A1C, have an antioxidant effect, lower blood sugar and even help treat some of the complications related to diabetes. Large doses of zinc can inhibit the absorption of other minerals like copper, so be sure to ask for guidance of the appropriate dosing. 5. Aloe Vera. The sap of aloe vera is known for its laxative effect. Therefore, make sure to get the juice of the gel. There is increasing evidence for use of the gel, which is the mucilaginous material inside the leaves. Be sure that any product you buy is free of aloin or anthraquinones to avoid finding yourself in the bathroom. 6. Berberine. This is one of my all-time favorite botanicals found in plants such as golden seal, barberry, Oregon graperoot and coptis. Current evidence supports its use for decreasing blood sugar and A1C. Be aware that this herb can interfere with metabolism of traditional pharmaceuticals and should never be taken while pregnant. 7. Cinnamon. It is medically beneficial indulgence to help lower your blood sugar and cholesterol levels. Study shows, people with type 2 diabetes who took either 120 or 360 milligrams of cinnamon extract before breakfast saw an 11% or 14% decrease in fasting blood sugar. 8. Fenugreek. A seed commonly used as a food spice has been used abroad for centuries for its medical benefits to lower cholesterol and A1C. If your urine smells like maple syrup, not to worry, this is a known side effect and is harmless. 9. Gymnema. Used for centuries in India, evidence is catching up to its medical use showing benefits for glucose metabolism, insulin levels and as an adjunct to improve the results of traditional pharmaceuticals. Be aware, because this botanical works synergistically with your meds, you must monitor your blood sugar closely to avoid having hypoglycemia. 10. Nopal. Ever see nopales at your favorite Mexican restaurant? Now you can order them and, rest assured, you're choosing a food that help lower your blood sugar. Nopales are the pads of the prickly pear cactus and when cooked right are delicious. I personally like eating them with eggs or as a salad. Okay, it is time to take action. If you want to learn more about how to reverse diabetes, then please listen carefully. You might not know it, but you're at an important crossroads in your life right now. And you really just have 2 options, leading to 2 very different lives. 1, a lifetime of energy and hope and passion for life, where you love your body and are amazed every time you look in the mirror, where you are no longer shackled to diabetes, the medications, the finger pricks and test strips. The other, well, the other is just a continuation of the life you have now. So, listen closely as I tell you what your 2 options are so you can make the right choice for you. Option number 1, you can choose to do exactly what the mainstream healthcare system want you to do. and carry on taking your meds. Remember, by doing this you'll never be free from drugs. Diabetes medication was never designed to cure you. It was designed to manage your condition, so that you remain trapped on the medication merry-go-round until the day you die. That's the way the big pharma-backed diabetes treatment system works. It locks you into a lifetime of drug dependency. I think you already know what will happen if you do take this option because you've felt it so many times before. That feeling of hopelessness, of being trapped in your body, of feeling yourself getting heavier and more exhausted and more fed up with your struggle with your weight and with your body every single day. Wondering why it's so hard for you to get in shape and stay in shape. Or feeling guilty because you aren't spending hours and hours at the gym. Every week pedaling as fast as you can but not getting anywhere at all. I know you don't want that. And remember, the average diabetic will spend $283,000 to treat the disease and its complications during the course of their lifetime. That's the financial cost of doing nothing. The human cost is far greater. I'm talking about coma, heart attack, stroke, nerve damage, kidney failure. Cutting your life short by years, even decades. Option number 2. Do something about it. Just imagine the difference this could make to your life. No more fear of a fatal diabetic coma. No more fear of forgetting to take your meds. No more fear of the inevitable worsening of your diabetes over time. No more finger pricks or test strips. No more injections. No more having to deny yourself the foods you love. In a lot of ways, it's the easier road because all it takes on your part is deciding you love yourself enough to say yes right now. To learn more about what you can do today, simply click on the link in the description below this video. I have quite a few surprises I haven't told you about, but I can't wait for you to see. Learn a simple, tested method that saved Kathy from type 2 diabetes and an early grave. Click on the link in the description below, and I see you there. Thanks for watching my video.